I'll see them. Hi, Dr. Gulani. So it's Monday morning and I'm back. I'm on patients who are arriving today from all over the nation. Many of these patients are coming with complaints of poor vision following premium cataract surgery with their surgeons. And I'll share with you videos of how I've been using lazrplastique to correct these patients' vision without having to remove their surgeon's lens implants or exchange the lenses or do any invasive surgery.
3, 2, 1.
So we are just finished doing lazrplastique on the panoptic lens cataract surgery that you had in South Carolina. Can you tell any difference?
Yeah, the amber light is clear.
Yes.
So there seems to be less halos with the light around it. Red light.
Very nice. Any pain at all?
No.
For doctors watching, you can see right there. You can see the circle of sight that always translates to vision, and we've also corrected, you can see the Purkinje image of the panoptic lens in the eye. So we have corrected the vision without the need to exchange the lenses. That's the biggest thing I like to teach. We are correcting his optics with his own eye. Congratulations. Safe travels back to South Carolina.
3, 2, 1.
Just finished doing lazrplastique on your irregular radial keratotomy cornea, which is done over your premium cataract surgery in Texas. Can you tell any difference?
Yes. Well, before it was just the gold light blinking, and now it's the same. It's more distinct.
Perfect, more distinct. For doctors watching, you can see there a perfect circle of sight. Despite a radial keratotomy cornea, premium cataract surgery, Purkinje reflex right there. And that always translates to vision. Is that correct, sir?
Yes.
Congratulations, safe travel back to Texas. On this patient with radial keratotomy and light adjustable lens in the eye, and we're going to correct this with lazrplastique. Thank you. So we are just finishing lazrplastique on your complex cornea with radial keratotomy, cross-linking, LASIK, PRK, and you also have a light adjustable lens in the eye. Can you tell any difference?
Well, it looks clear.
Yes?
Yeah.
How do you know that?
I don't see any like blurry, convoluted.
Wonderful. Any pain at all?
No pain.
Congratulations. Look up there, doctors. If you can see the screen has a perfect circle of sight, which always translates to vision. You can see behind the Purkinje image of the light adjustable lens that she had back home, close to Michigan, and you have RK, LASIK, PRK, cross-linking, all that's going on, and you're corrected with lazrplastique to a perfect circle of sight. Congratulations. Pleasure. You're all done. Congratulations. Safe travels back to Michigan.
Thank you.
A pleasure. Absolute pleasure. Image and reflex, you can see a very high oval, which is a mark of very high astigmatism and central irregularity from scars of radial keratotomy in cornea here. And patient has had cataract surgery elsewhere, and that's a very high irregular astigmatism with poor outcomes. Very nice. Fantastic. Can you tell any difference?
The circle and the dot seem to be much clearer.
Yes? Fantastic. Any pain at all?
Well, there seems to be better resolution, especially on the circle.
What is that?
The circle,
Uh-huh.
the broad white circle seems to be clearer, and the dot seems to be clearer.
Wonderful, wonderful. And doctor, this is very important. This gentleman has a very ectatic, very irregular cornea with radial keratotomy. He's had his cataract surgery in Louisiana, right?
Yes.
And his overall visual is right now at 2400. He also has macular degeneration, which is limiting his vision to 2150, just 2-3 lines better. Yet he's noticing a difference from our improvement on his irregular cornea. And if you see the screen there, that translates to a perfect circle of sight that you can see there. That always corresponds to vision. Correct? It's been a pleasure.
I feel very comfortable when you work around with Dr. Gulani.
It's been my pleasure. That's your pleasure. Safe travels back home to Louisiana. Wonderful. Doing lazrplastique on your extremely complex radial keratotomy cornea with scars. Can you tell any difference?
Yes. I can tell the difference. I can see through white light and
Wonderful. Excellent. down. So if you see that, doctor, you can see the perfect circle of sight in this patient who's had previous pseudophakia with her surgeons. And again, without exchanging the lens, we are correcting her radial keratotomy cornea straight to the optics of the lens and making her see. Congratulations. Here she is.
All right.
Doctor.
Hey, dear.
Did you watch it?
I watched every bit of it. Yeah, it was great. He cleaned off what he cut down. It was great. It was really good.
Cornea is nice and smooth. Scars
I
are
know
gone.
you could see the smoothness of it once he was done. He dropped the liquid on there.
You
Just-
saw the surface.
Absolutely. I saw you bubble up the stuff and wipe
He's
it
like
off.
a surgeon by now. Eye surgeon with both his
It was
eyes
really
done.
good. It looked. I mean, it's so
Can you tell
amazing.
any difference? Even though a little bit blurry should be in the dark. Can you tell any difference?
Yes.
Yes?
I can.
And do me another thing, Michelle. Can you read anything here?
581.
Is it better than before surgery already?
Oh, yes.
Amazing.
I couldn't read without cheaters before.
And this is doctors. Always I'm teaching. This is one of our most amazing patients. He's an amazing surgeon himself who had RK's issues, and it's a pleasure for me because they have really inspired me. And today his wife with RK complications, she's had premium cataract elsewhere. How without changing the lens we are making the cornea work with the optics of the lens. And not only that, I've created a multifocal cornea so she can see distance and near at this point. And how many years since you've had your premium cataract with your surgeon?
15.
15. After
Easy.
15 years also you can give them back what they should have received 15 years ago. That's the point.
That's why we came here.
My pleasure, yeah. That's a pleasure, Sean. I'm very proud
Oh,
of you.
definitely.
And
Wouldn't
your
have gone
sons?
anywhere else.
That's a pleasure.
Love you, buddy. Love you.
You are-
Thank you. You're like family does too.